I am going to walk you through some of the key features of the stroke care prototype. Rob Jones lives in Manchester and his parents live in Bristol. His father has had a stroke and been taken into the North Bristol A&E department. Rob's mother phones him, clearly upset and concerned. The A&E staff have been fantastic, but he is on the general assessment ward and she is confused about what should be happening next. He types stroke care in Bristol into his search engine and the Our Health stroke page comes up. Rob sees that he needs to set a location, and so he clicks on please set a location and enters Bristol. He can either enter his postcode, click on the map, or enter the initial of the town that he's looking for. He decides to enter Bristol. He sees that there is a section about hospital care and he clicks on this to find more information. From this he can see that he should expect for his father to be on a dedicated stroke unit. This is clearly not the case, so he wants to find out a bit more about how local services perform. He clicks on this button. He can see that there is information about the proportion of time that patients in the hospital spend on a stroke unit, and so he clicks on North Bristol to discover more. This page tells him why this indicator is potentially important and the clinical benefits that result from good performance, and some information about interpreting the data, including a comment from the North Bristol Trust about work that they're doing to try and improve their performance. He can click on other buttons to compare how North Bristol compares with other hospitals, and he can view the trend through time for this indicator at North Bristol Trust. Rob's father is transferred onto the stroke unit and he successfully starts rehabilitation. He is discharged from hospital back to his own home where his wife supports him. A few days after arriving at home, Rob comes down to stay with his parents to help them plan the next few stages. He logs on to Our Health and shows them the materials that are available, including further information about rehabilitation at home and some information about living well with stroke. He sees that there's information here not just about health services but also a range of other services, and he can access links to the Stroke Association website about life after stroke services. He notices two other features of the site that he talks to his parents about. One is the option to ask a question if they're looking for help and advice from other people who've had strokes or care for people who've had strokes. And the option to provide some feedback about the experience that they've had. When they click on this button, they see there's an option to take a survey. The survey is not only about their experiences in hospital, but about the whole of the stroke pathway.